Ozempic has been called a game changer for people looking to manage type 2 diabetes and, in many cases, for those pursuing weight loss. But along with its success stories comes a common question. What about the nausea and digestive discomfort? Why does this medication, praised for improving blood sugar control and supporting weight loss, also bring on such unpleasant side effects for so many people? And more importantly, what can be done about it? Let's dig deeper, because the reasons may surprise you. First, what is Ozempic, and why does it affect digestion? Ozempic, also known by its generic name semaglutide, is a GLP-1 receptor agonist. That means it mimics a hormone in the body called glucagon-like peptide 1, which plays a role in blood sugar regulation, appetite control, and digestion. But here's where it gets interesting. GLP-1 slows down the rate at which your stomach empties food into the intestines. This effect helps you feel fuller, longer, and stabilizes blood sugar. However, the same process can also cause nausea, bloating, and even constipation in some users. In fact, research published in Diabetes, Obesity, and Metabolism in 2021 found that nausea was one of the most frequently reported side effects of GLP-1 medications, particularly in the first few weeks of use. But why do some people experience severe nausea while others barely notice it? The answer lies in dosage and how your body adapts. When starting Ozempic, most providers recommend beginning with a low dose and slowly increasing it over time. This stepwise approach gives the body time to adjust to slower gastric emptying. But for some individuals, even the starting dose can feel intense. The good news? According to clinical studies, most nausea symptoms tend to improve after the first 4 to 8 weeks of treatment as the body acclimates. But what can you do in the meantime to reduce these uncomfortable symptoms? Here are practical, evidence-informed strategies. Eat smaller meals more frequently. When your stomach empties slowly, large meals can overwhelm the digestive system and worsen nausea. Eating smaller, balanced meals every 3 to 4 hours often helps. Choose low-fat, low-grease foods. High-fat meals linger in the stomach longer, compounding the delayed emptying effect. Lean proteins, vegetables, and whole grains are often easier to tolerate. Stay hydrated, but sip slowly. Chugging water or other fluids too quickly can worsen the feeling of fullness and nausea. Consider ginger or peppermint tea. While studies are mixed, ginger has long been used as a natural nausea remedy, and some patients report relief with peppermint. But what about anti-nausea medications? Are they safe to use with Ozempic? Here's what research and clinical experience suggest. Doctors sometimes prescribe medications like ondansetron for temporary relief of nausea. However, most providers prefer lifestyle strategies first because nausea often resolves naturally with continued use. If you're unsure, speak with your healthcare provider before adding anything new. But here's where it gets surprising. Some users report that skipping their dose to reset their system can actually make things worse. When you stop and restart, your body may have to adapt all over again, potentially triggering nausea again. This highlights an important point. Consistency matters. Taking your dose on the same day each week at roughly the same time can help stabilize your experience and minimize surprises. Other digestive symptoms like diarrhea or constipation can also appear. Why? Again, it's tied to slowed gastric emptying and changes in gut motility. Some people experience looser stools, while others find things slow down too much. Gentle adjustments, such as adding fiber-rich foods or supplements like psyllium husk for constipation, or sticking to bland foods when diarrhea occurs, often help balance things out. But remember, persistent vomiting, severe abdominal pain, or sudden changes should never be ignored. While rare, GLP-1 medications have been linked to pancreatitis and gallbladder issues. The FDA prescribing information for Ozempic specifically advises contacting your provider if you experience severe or persistent abdominal pain. So, how long do these side effects last? For most users, nausea and mild digestive discomfort peak in the first month and gradually fade by week 8 to 12. In clinical trials, fewer than 5% of participants stopped using Ozempic because of nausea after dose adjustment. That means if you can stick with it and use simple strategies to manage symptoms, The odds are good that things will improve over time. But what about individuals who never adjust? A small number of people simply can't tolerate the slowed gastric emptying. For them, alternative medications or lifestyle-only interventions may be better options. That's why working closely with a healthcare provider who can personalize your plan is so important. And here's something you might not expect. Some researchers are exploring whether the nausea itself may actually contribute to weight loss by reducing food cravings early on. While no one wants to feel sick, temporary discomfort may be one reason why GLP-1 medications are so effective in reducing appetite and food intake. The bottom line: nausea and digestive upset are among the most common early side effects of Ozempic. But for most people, these symptoms are temporary and manageable. Eating smaller meals, choosing lower-fat foods, staying hydrated, and giving the body time to adapt can make a big difference. If symptoms persist or worsen, it's important to speak with a healthcare professional to rule out rare but serious complications. Want to learn more about Ozempic, weight loss medications, and how to manage common side effects? Be sure to subscribe to this channel and share this video with anyone who might find it helpful. Your support helps us create more trusted health and wellness content. Thank you for watching.